Hello again. This is Chronic Hiccups, update number 6 or 7, maybe. Okay, yeah, I have a few announcements, things to say today. Actually, I have a lot. Last Thursday, when I uploaded, I talked about having an attack, I believe. And I had 2 more attacks Friday, and I had to stay in bed all weekend because if I got up, I started having an attack. I'm taking off all my medicines right now, so that's kind of nice. I don't have to sit around hoping I remember to take every single medicine I own. I watched the Pierce Clinic in Florida's video, Hiccups Before and After, where they talked about the neck adjustment, which was suggested for me to view by Gangsterface 90 or 09. I will remember that one day. I'm pretty sure it's 90. No, maybe it's 09. Now I'm confused about it. But, I watched it, and I mentioned it to my mom. I mentioned, how they did, the shock waves through the neck. Not shock waves, sound waves through the neck to, realign your neck. The only thing that she said was she didn't think it would work on me because there's nothing actually wrong with my neck. Oh, everything's imported already. And so she said that it probably wouldn't work. But I think next time I see the neurologist, which is in October, I'm gonna mention it to him, because if it's just something as simple as that, then that'll be nice. Hopefully I can get in to see a neurologist before October. I went Tuesday to the ears, nose, throat doctor, who happens to be quite frightening. Not frightening, but it was a kind of scary visit. It's not in the hospital, but it was right next to the hospital, and we filled out a bunch of paperwork for me, and then we went into the room and filled out more paperwork, and I had to talk about my symptoms and stuff. And then, oh my god. Okay. Now that I figured that out. Sorry, things are popping up all over the place because I just imported my 50th video, which I recorded right before this because my computer was being nutty outside. You get a tour, then I talk a lot, and then you get a little bit more of a tour. Anyways, and then I went to see him, and he looked in my ears and didn't find anything, looked down my throat and didn't find anything, not sure how he looked well down my throat, and then he looked in my nose, before using the scope, and he couldn't find anything, so he's like, let me use the scope and stick it up your nose. So they put 2 different sprays in, sprayed in my nose, which was gross, really, because, they tasted bad. I didn't really care for, it didn't taste good, but it wasn't terrible. But, it just dripped all down my face, so I was, dabbing my face the whole time. And then he went and got the scope that they use on little 6-year-olds, because I was afraid to use the bigger scope. And it let my nose expand, and it didn't really numb my nose like it was supposed to. It really numbed my lips and tongue more than anything. And then you had to sit up straight, chest out, chin up, head back. So I did that, and he put it in, this side of my nose and just looked in the nose here, and then he went in this one and brought it all the way back down into my throat a little bit. And from that, he told me that there was a lot of swelling within this part of my nose and a little bit more up here, where it goes off into the sinuses. And then he told me in my throat it was kind of red, lots of irritation, and I had a lot of extra tissue in one part of my throat. I wish I had a diagram to show you. And like, okay, but like, the extra tissue, it's supposed to be there when you get older. Like, the tissue's supposed to gather as you age, and I had a lot more than I should have, and it really explains like how my voice gets hoarse and how like my throat feels more like closed off and it's harder to swallow things. But we're not sure how it connects to the hiccups. We don't know if it's just allergy irritation or if it's throat irritation from having the hiccups so much. So we have to look into that and talk to the neurologist about that. But I'm being put on nose steroid spray, I guess, allergy steroids, and then S something. It starts with an H. I couldn't pronounce it that day, and I can't pronounce it or even remember how to pronounce it now. And those are supposed to get called in, and I'm supposed to start that on Friday, and I think I'm taking like one pill before I go to bed and doing my nose twice a day. And my nose still feels awkwardly expanded, where like it was pushed all the way up. Like, the rest of the day I was like touching my nose because my nose felt huge. And then I still have to go get blood work. I guess we're still filling out paper for that or something. But after blood work is done and taken, and I freak out over the needle, we're gonna call and see if the neurologist wants to see me sooner, because we'll have had everything done. Other things I have to tell you, there was a list. My voice is getting kind of hoarsey, which means after I finish this, I'll be going to take a water break. I swear, the ears, nose, throat doctor said more things. He talked about, like, how sometimes when you have the extra tissue in your throat, it's because of allergies, and sometimes because of irritation, but, he's not sure which. And then, if the allergy, we're going to see him again in a month, and if the allergy treatment doesn't work, he's putting me on acid reflux medicine, even though I don't get heartburn or anything, which I don't know exactly why he's going to put me on the acid reflux medicine if I'm not getting symptoms, really, of acid reflux. But I don't know that much about it, and someone commented on my last video, or the video before my last video, about the Seroquel, and they said that they take it for like depression and stuff, and anxiety, and like paranoidness, being paranoid. I'm trying to think of the word for it. And I explained to them, but I'm going to explain to you that the Seroquel is used on me because it helps relax muscles within your body that like tense up or like spaz. So they were hoping it'd be able to relax whatever was really causing the hiccups in me, because there's so many causes. But it didn't do anything, and the same with the gabapentin, which is used for like stuff. Seroquel is also used for schizophrenia and sleeping. And I think I have the bottle. I'm gonna go check. I believe I took it 3 times a day at 25 milligrams because that was mentioned. Because I do still have the bottle in here. Yeah, I have 25 milligram tablets. They took it like at 200 milligrams. I'm pretty sure it's milligrams. At night, I took it at 25. 3 times a day, so I took like 75 milligrams of it a day. We didn't continue with this because it gave me really bad side effects. They talked about, I can't think of the name now, I might have mentioned in my last one, Abilify. Abilify is the name, I'm pretty sure. Yeah, I'm pretty sure. It's like, it's an antidepressant, or like you add it on to an antidepressant. And it was recommended by the pediatric neurologist, before, up at Dartmouth. And so, if the allergy stuff doesn't work and the acid reflux stuff doesn't work, if I even get put on it, then excuse me, then we're doing that, definitely. On Monday and Tuesday I couldn't sleep. Like, Monday I woke up at like 4 in the morning and couldn't sleep again for like pretty much no reason. I don't remember. I don't think I was hiccuping. And then Tuesday night I fell asleep at like 8 o'clock because I was really tired. And like every hour or so I woke up hiccuping and would fall back asleep until like 2 in the morning where I couldn't sleep again. So I'm slightly tired from that. And I have a really short attention span right now because of it. I actually slept last night, which is good because I was job shadowing this morning, and if I didn't, I'd be like, nah. The hiccup attacks, like, where I can't breathe, I feel like they're starting to come a little bit more than they had been. Along with sneezing, I feel like I've been sneezing more. I sneezed twice at band practice on Tuesday, and by twice, I mean 2 different sets of sneezing and hiccuping, and both times they stopped what they were doing to make sure I was okay and breathing. And so, that's pretty much been what I've done so far. Next week is like the last week before school, and so back to school means probably shorter updates. Not really short, depending on homework. They might be recorded at random times in the week and just uploaded on Thursdays. I meant to make this video Tuesday right for the doctors, but I forgot. And also, it means I'll be talking less in medical terms and more in like, not educational terms, but like how I'm getting my education with it, and like how that's going, and like drama and blah and after school activities and stuff. And oh, my cute cat's here. Hold on, this guy hasn't been to my camera yet. Say hi, little squirrel. That's my cuddly cat. Sorry, that doesn't really pertain to this, but it's ending, so you saw my cat, who came and cuddled with me this morning, and tends to cuddle with me, but my hiccups sometimes scare him. And so, I'll see you next week. Hopefully, I'll still have good things to update about, but until then, you can watch older videos, newer videos, random other videos of mine, and yeah. Bye, guys.